Study shows that nearly a year into the pandemic, many people still don't follow basic guidelines for protecting themselves. This morning, Jared Aarons takes an in-depth look at the numbers and why psychologists say it's so difficult to get everyone on board.
In many ways, this pandemic is like a perfect storm of factors that lead to poor decision-making.
Rachel Blazer is an associate professor at USD's Department of Psychological Sciences. She says the constant changes to coronavirus rules are one reason why some people still don't follow them.
We've been getting these mixed messages for so long, or for very valid reasons, the science has changed, or the regulations are changing.
Regulations like mask mandates, what's open or closed, inside or outside, even whose house you can be at. Keeping track of all of it can get confusing. New numbers from USC's Understanding America study bear that out. 90% of Americans say they wear a mask, and 96% say they wash their hands. But 63% say they've had close contact with people outside their household, and only 49% of those wore a mask while doing so. 15% say they've gathered in groups of 10 or more, with only 47% wearing a mask. And 9% say they ate at a bar or restaurant, with only about half wearing a mask while there. Blazer says those numbers show most people are following the rules. Focusing on them instead of criticizing people who don't could be key to getting everyone on board.
Show that, yes, a few people might not be, but we're all in this together, we're all working hard, and you can join us in doing that.
In psychological terms, it's called the cost-benefit analysis, where people weigh the pros and cons of any decision at a subconscious level. But in a pandemic, the con of missing friends and family or being uncomfortable are immediate, while the pros of staying healthy is abstract.
Maybe in 2 or 3 weeks you might have symptoms. Maybe in 2 or 3 years there might be side effects that we don't even know yet what they are. And that's just not how our brains work.
So to change behavior, Blazer says the messaging needs to be more consistent with mandates versus guidelines, since people will follow mandates.